it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today Maddie and I are going to be chatting about cat anesthesia and things that you can expect, possible complications, what the process involves, and hopefully this will help answer any questions or concerns that you may have about putting your cat under anesthesia.
Dr. Denney, what is anesthesia?
So anesthesia is the ability to put the animal or the cat completely asleep where they're not going to feel any pain and they'll be unaware of what's going on. We use this for surgeries. Sometimes we'll use it for treatments if we have a cat that's particularly spicy, like a spicy burrito. We'll use it for those kinds of cases. I call it time traveling for those fractious cats, or the cats that have lots of feelings when they come in, not only for their safety but ours. But I call it time traveling because they go to sleep, they get their treatments, their testing, and then they wake up and it's all done. Woohoo!
What is the difference between anesthesia and sedation?
So anesthesia is where we are completely asleep and unaware. We're not reactive to any stimuli. Typically cats' ears are very sensitive, so a good test is just sticking your finger in their ear, and if they're not reacting, or kind of tapping here and seeing if they blink or not. It's a good way to know if they're fully under anesthesia or not. Sedation is where they're not completely asleep. They are relaxed, they're not stressed. We're able to move them if we need to, but they're not completely asleep. They can breathe on their own. They have control of their airway. With those procedures, again, for our kitty cats that maybe are not quite so happy, but not, actively being super spicy, we might use some sedation to help get treatments done. We do have some cats that are super anxious that'll get some sedation before they come into the practice called gabapentin. It kind of takes the edge off. It makes them to where they're not so fearful. They're easier to be handled, which means the whole exam, treatments, testing, etc. goes a little much faster because cats don't do well with change, so it's better to make their visits as fear-free as possible.
What do I need to know before my cat goes for an anesthetic procedure?
So this is something that we will talk to you about if you're having your procedure done here. The biggest thing is no food or water after 9 o'clock the night before, no breakfast the morning of. This is to make sure that we don't get any regurgitation or vomiting. In cats, we do place a breathing tube called an endotracheal tube to help protect their airway. And there's a little bubble that you push some air into and it inflates, creating a seal in the trachea. That way, if God forbid they do, it doesn't get into their lungs, which can lead to something called aspiration pneumonia, which is a possible complication of any anesthetic procedure.
What are some possible complications of anesthesia my cat could experience?
So we just talked about one, the aspiration pneumonia is one. Unfortunately, even though the risk is extremely low, we can see cats and dogs could have anesthetic reaction, and there's no way to prepare for this. In a very small subset of animals, they can pass away under anesthesia. It's extremely rare. In my almost 11 years of practice, this only happened just a couple times. I remember each and every one of those patients because it's just, even if you do everything right, we do preoperative blood work, we have IV catheters, we have full monitoring of oxygen levels, CO2 levels, blood pressure, body temperature, heart rate, EKG, everything you can think of, any kind of monitoring that you can have on a patient, we have it here at Four Paws at Fulshear. And also we had other practices that I've been at, and even doing everything right, things like that can happen, and there's really no way to explain it. Some cats can have what's called silent heart disease. There are some breeds that are going to be more predisposed to this, and in those cases we're going to go ahead and do some additional testing before going under anesthesia. Those breeds are going to be ragdolls, Maine Coons, Sphinxes. They can get underlying heart disease that's called silent heart disease because we can't hear it. There's no murmur, there's no arrhythmia, there's no change. It actually has to do with the structure of the heart wall. So there are some specific tests that those breeds in specific will need to have done prior to going under anesthesia. But we do our very best to make sure that it's as safe as possible. We also keep our owners updated at least every 20 to 30 minutes while their pet's under anesthesia, letting them know what's going on. When their pet's in recovery, we send pictures because it's scary and it's stressful. And if your pets or your cats are anything like my 4 cats that I have at home, they're my babies. I don't have kids, so for me, these are my kids, so I understand the fear and the anxiety, so we do the best we can to alleviate that.
What type of at-home care should I provide as my cat is coming out of anesthesia?
So quiet, dark. You don't want them around any loud noises. You can offer food later that evening. I usually like to keep my cats in a room by themselves where there's not a lot to run and jump on. Dark, calm, cool, quiet, access to food and water in a litter box. And just close monitoring. Most cats might be a little off balance, a little stumbly. Some cats are just going to want to go sleep it off. Other cats will hide. That's normal. But just, I think quiet is going to be the biggest thing, because cats are natural predators. And so whenever they're not themselves, their instincts are on, going crazy because they're worried that something could happen to them. So keeping them in a dark, calm, quiet place is going to be ideal for their recovery. All right, thanks guys. If you have any more questions about feline or cat anesthesia, what to expect as far as concerns or process, please give us a call over at Four Paws at Fulshear. Thank you.